Every part of this province is contending with COVID-19 right now. Charnel Anderson is a new, well, sort of new member of our Ontario Hubs team. She'll be helping to cover the northwestern part of the province, and she joins us now from Red Rock, which is about an hour northeast of Thunder Bay, for an update. Welcome, Charnel.
Hi, Jayanne. It's great to be here.
Now, Charnel, I think the last time that we saw each other, well, I know the last time we saw each other was in Toronto. You are now back home in Red Rock, covering the Northwest for TVO. Tell us, how do you feel to be back?
Yeah, that's right. Well, there's no place like home. I was born and raised in Thunder Bay, and as you said, I'm not staying in Thunder Bay right now. I'm in Red Rock with my parents, and it's nice. It's beautiful here. I'm right by the lake, and it's a good place to kind of hunker down and social distance, right? So I'm lucky.
Now, I want to talk about the COVID-19 situation there right now in the Thunder Bay District Health Unit, which you're going to let me know covers a lot more than just Thunder Bay, of course.
Yeah, that's right. So before we get into the numbers, I just want to give you an idea of how big the area is that the Thunder Bay District Health Unit covers. So in the east, we go from Manitouage, Marathon, Greenstone, and then the health unit also serves many communities up north, as far as Fort Severn on Hudson's Bay. To the east, we have Conmee, O'Connor, Gillies, and in the south, we go to Nebing, so it's quite a large area. In terms of cases, as of April 29th, there are 69 confirmed COVID-19 cases in Thunder Bay and surrounding areas. 51 of those cases are resolved, and 17 of them are active COVID-19 cases. Last week, we learned of the first death in the region, which is a man in his 50s. He was working at the Lac des Iles mine. And as for testing, there's been more than 3,000 COVID-19 tests conducted in Thunder Bay and surrounding areas.
I want to pick up on the one death there at the mine. How many others at the mine have been infected?
Right, yeah. So as I mentioned, there's been one death, a man in his 50s. He had underlying health conditions. And in a report put out by Impala Canada, which is the company that owns and operates the Lac des Iles mine, they put out that report on April 27th, and they said that there have been 25 COVID-19 cases linked directly to the mine. The outbreak there began on April 4th, and so far 13 of those cases have been resolved.
So it's been about 4 days since that report. Can you tell us about what they're doing at the mine to help curb the spread?
Right. So in that same report, the company mentioned that they've done a deep and comprehensive cleaning of the camps there where the workers are staying. The mine itself is in care and maintenance mode. So what that means is that the mine is closed, is no longer operational, but there is a team of people there who are dealing with, different processes and conditions that need to be maintained in order for the in order for the mine to open back up when all this is over. According to the report, there's less than 50 people who are doing that care and maintenance work.
Now, there is a connection to that mine to Gull Bay First Nation. They've been hit hard with a number of cases. Now, this is a community about 200 kilometers north of Thunder Bay. What can you tell us about that small community there?
That's right. So Gull Bay First Nation, the chief there, he believes that some of the cases, there's a total of 7 cases right now in Gull Bay. He believes that those may be linked to the mine at Lac des Iles. The community itself, there's about 350 on-reserve members, and a number of those members have worked at Lac des Iles. So that's why the chief believes it may be connected.
Now, you mentioned 7 cases, which I think a lot of people would be like, that seems like a small number of cases, but this is a particularly small community, about 350 people, and a lot of Indigenous communities are about that size. What is it about Indigenous communities that make them particularly vulnerable to COVID-19?
That's right. So, of course, we have a number of guidelines from public health officials that we're supposed to be following, including, washing our hands, staying at home as much as we can, maintaining physical distance as well, that's 6 feet. But this is a challenge for many First Nation communities where there's overcrowding, there's multi-generation households with multi-generations, couple of families in the house, 6 to 10 people. That makes it really challenging for, to stay away from each other. As well, there's issues with access to water. A lot of First Nations in Ontario are on boil water advisories. Some communities don't have running water, which makes it difficult to go. You can't just go to the sink and wash your hands. So there's a number of things that make it hard, if not at times impossible, for people living in First Nations communities, to follow these guidelines that do help lower the risk of transmission of COVID-19.
But you are being told there are some reinforcements on the way or already there.
That's right. So there's 2 nurses who go to the community on a regular basis who are there, and they've been supplemented with 3 additional nurses. I understand there may be more on the way. As well, over the weekend, it's called the Blue Med Assessment Facility, and it's kind of like a tent structure where they're doing testing. Since Monday, they've done about 10 to 15 tests a day, and they're aiming to test as many people in the community as want to be tested.
Charnel, I want to welcome you back to the Ontario Hub's team, and I want to thank you, of course, for bringing some important stories to the show. So that's Charnel Anderson, our newest Ontario Hub journalist covering Northwestern Ontario. Thanks again.
Thank you.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.